Agency works with people that are 66 up to 75. We don't discriminate older than that, but that's our target market because we found that these seniors have been neglected and abandoned and orphaned clients from their agent who only knows how to do turning 65 business. And again, there's nothing wrong with that focus, but I want you to know there's a big difference in what can happen if you pick the wrong agent. Okay, here's a perfect example. This is Miss Colleen G. She's in Midland County, Michigan. She just turned 66 and got her first rate increase. She's with Blue Cross Blue Shield, Plan F, okay? Very popular, Plan F, and Blue Cross in Michigan is very popular. Her rate every month now has gone to $220 a month. Guess what? She can't find her agent who sold her when she turned 65. Nowhere to be found. He doesn't know what to do to help her save money. Now, we've always covered, again and again on these videos, the Medicare and You Guidebook, which very clearly states, this year on page 68, that all the Medicare plans are the same. So if you want Plan F, it's the same with Blue Cross, it'd be the same with Humana, United Healthcare, New Era Life. It's the same for all of them. The doctors are paid the same way. Every procedure is covered the same exact way. Every doctor and every hospital are going to accept it the same way, paid electronically through the Medicare system. So all the plans are the same. The only difference, according to the Medicare and You Guidebook, which is true, is the premium that you pay. So Miss Colleen here, paying $220 a month, we identified Stonebridge Life at $131.85. That's a monthly savings for her of $88 a month, the same exact coverage. And that's only after 1 year of leaving the turning 65 only agent. Now, who do you think is going to get this woman's loyalty when we're saving her $1,056 a year in the first contact that we have with her? We will. We'll be her agent for life because we'll continue to shop this every year rather than just one shot and then never see him again. So it's $1,000 a year on a single senior lady on a fixed income. That's why we're in business. Here's another example. This is Miss Hall. She is in South Carolina, 71 years young, so she's been 6 years without her agent. Never heard from him again. She was with Genworth. Now she's up to $252 a month for Plan F. $252 a month. We identified Cigna Plan F at $139.61 per month. Same benefits. Very strong company. Great customer service. This is saving her $112.39 a month. $112 a month. For a lady, this is a widow, and her husband used to handle all this stuff for her until we reached her, and now we're saving her $1,348.68 a year. Now, she can't find her agent either. Never has heard from him again since she turned 65 and thought she stuck with that old plan. But because we know the underwriting, we know what she'll qualify for, and we know what the rates are in the entire market because we don't work for just one insurance company, we're able to save this wonderful lady $1,300 a month. And the last example I have for you today, this is just from last week's clients. This lady, excuse me, she was with Sterling Investors Plan D, kind of an old plan, and not many people buy Plan D anymore. It's similar to today's Plan G, which is a little bit better. But anyway, she's paying $272 a month. $272 a month. She's 74. She's a smoker, so she's got a little bit higher than normal rate for that. But we were able to find her Plan G, same benefits but more coverage. There's additional coverage on Plan G for excess charges if the doctor charges more, for $150 a month. $150.07 to be exact. We are saving Miss Graves $122 a month, which is $1,464 a year. That's real money right back in her pocket. She also is a widow. So she's 74, Miss Hall was 71, and Miss G down here was 66 years old. None of them have any idea where their agent went. Their agent that chased them down, knocked on the door, called them on the phone, filled up their mailbox with mail when they're turning 65, suddenly, poof, vanishes. And my experience this past week with speaking with one of these turning 65 only agents is that they just don't know what to do with the person. They're sad that they've got a rate increase, but in many cases they don't even return their phone calls because they don't know what to do. And worse, some of the agents are only captive agents, which means they work for one carrier. That's the only carrier they can recommend, like Colonial Penn, Bankers Life. Some Mutual of Omaha agents are just captive only. And the bad part about that is if you're a a carpenter and the only tool you have is a hammer, everything looks like a nail. You got to solve everything with your one company, and many times that is just not possible. It pays to have an independent broker that can look in the entire market and has loyalty to the client and not to the insurance company. That's what we do. We don't care if it's going to be Bankers Life or Mutual of Omaha or Cigna or New Era. Who's got the best value plan, and more importantly, who can you get qualified for? See, if you know the questions that they're going to ask and you know what their underwriting criteria is, which we do with all the plans in our markets, then we won't recommend a company that you won't get qualified for. We'll ask you a few basic health questions, and based on that, we can find the best rate for you. It's a very simple process to change companies. It only takes about 10 minutes on the application, and we do all the work for you. The companies that we deal with have electronic applications, so you don't even have to fly down or us fly up and sign anything. We do it right through a screen share, so you can see everything. If you can watch this video, then you can watch over our shoulder as we do the electronic application. Very, very easy. We do all the work. We just merely send you an email with the information, and you click on the little bitty link there, and suddenly you're on our screen to see all the companies that are available. You can see the health questions, and again, it's a 10-minute process to save, in this case, $1,464, $1,348, and $1,056. That was just last week. And so we have a very small, limited scope of what we do. We help rescue the rates of seniors who have been abandoned by their agent when they were just 65. They're your best friend. After that, you can't find them again. So hopefully we can help you, and hopefully this has shed some light on a little bit about the Medicare market, how it works when people are turning 65, you know, chased like sharks chasing the meat in the ocean. It's just like there's a red blood feud of everybody trying to get that client. They want to get that client, and hopefully that client will stay there for the rest of their life. It's generally not in your best interest to ride one Medicare supplement plan for the rest of your life. The rates, they change a lot. And without a crystal ball, we have no idea of knowing who's going to have the highest rate increase next year. Or 2 years from now, who's going to buy out another company and have a significant rate increase. We don't know. So it's important that your agent remain independent and remain aware of what's going on in the marketplace like we do, because we want to stay in touch with our clients and always position them to the best plan for the rest of their life. See, we want a relationship, not just a sale. That makes a big difference. If we can help you, please call us at the number below. It's 800-729-9590. Thank you. God bless you, and have a great day. Bye-bye.